Empathy is an essential ingredient to high-quality health care. You can't treat the illness in isolation. You're treating a person.
I've always said if you don't have empathy, medicine is just a science.
With empathy, you actually get inside what the patient's feeling. You are embedded in it. Pathos, inside the feeling.
I think the best way to show empathy to patients and families is to show them that you're interested in listening to them, listening to their stories, that you care about them.
I think the most important thing is just to sit back and listen.
Answering their questions, treating them like a person, not a patient.
I smile, and then I listen to them with an open heart to whatever their needs are.
I just go in and treat them as if they were my family member, the way I would want my family member treated.
I like to sit down with people. I think it's less intimidating when you bring yourself to their level. It also shows that you're not in a rush to get out of the room.
I give them my undivided attention and just listen to them.
A lot of people come through my door and they just want to open up and tell me all about what's going on with them.
I look around the room and see the pictures that the family members or the loved ones may have put up. And then that allows me to see what kind of a person that they really were before they were sick and who they really are.
When I see a person come into treatment, I see the person first.
If they feel like you're trying to connect with them on a personal level, I think they will trust you more with what you're trying to help them with.
If a patient feels like they're being understood and that they're being heard, they're more likely to participate in their own care.
Everyone has a story. And our lives intersect at the bedside, and letting them know that you're interested in them as a person really helps with the process.
And I think it's through these little conversations that our life stories connect and we can learn about each other as human beings.
The beauty of it is that I never really know what to expect. So it's always about being in the moment and being able to relate to people.
Empathy is being able to put yourself in somebody else's shoes, being able to feel what they're feeling, their emotions.
Imagine that's your family member on the other side of you. So that can be your mom, your dad, your sister, brother, grandmom.
Empathizing with somebody goes a long way.
You know, a lot of our patients face unbelievable odds every day. It's amazing. I admire them. I admire how they cope with life, how they pursue taking care of themselves or their family members.
And if they're having a rough day, I say, can I give you a hug? And once they leave, they're crying, but they're leaving with a smile on their face.
And you just have to be their cheerleader, you know, when they're going in for another surgery or another bone marrow transplant, and just be there and cheer them on and tell them how great everything's going to go, and
cheer with them, cry with them, hug it out. That's my therapy, hug it out.
We know that the patients coming to see us at our hospitals are looking for hope.
This might be their first hospitalization. They're scared, they're nervous.
You can sense when someone's anxious by their tone of voice, their gestures, facial expressions.
They have to feel that you are approachable, I think, as a provider. So empathy is sort of a large part of getting across some of the barriers that people may have in accessing healthcare.
So much power is taken away when someone comes into the hospital or when their family member is like, they see them lying vulnerable in that bed. So if you can connect with someone on a personal level and make them feel less alone, I think it's huge.
First, attend to their primary need. It might not be for that blood pressure check or for that wound care. We don't know what other baggage they're carrying.
So I've had people refer to me with a question of a hernia, and yet when you get to the root of their basic concerns, they're afraid they have cancer.
For a patient to really feel that this was a good experience, they need to trust the organization that they're in. And in order for us to develop trust, we need to develop therapeutic connections with them to let them know that we have their back.
When you are walking into the room and you close the door, what I always say to myself is, it's just me and the patient in the room. The rest of the world is outside. You know, there are lots of demands outside. I'll get to them. But when it's me and the patient, it's just us.
Whether it's face-to-face or over the phone, the patient is my focal point, and that person has my undivided attention.
It's good for them to know that they can trust us and that we're here to help them during their situation.
They get more positive each time they come in. They realize that they're gonna come in and I'm gonna be sitting there smiling at them and be happy to see them. And eventually they're happy to see us too.
Regardless of their financial status, you know, we care about them as a person. And I think that by them knowing that, it will help them to relax more and it alleviates stress. And then they can focus their attention on recovering.
They will feel like they are being well treated and with respect. And I think everyone deserves respect.
Without empathy in medicine, you would only be treating one part of a patient, not the entire patient.
If we don't look at the person holistically, then we're missing a big part of them in the healing and medicinal process.
I think that empathy definitely is a form of medicine. Empathy leads to so many other things, a more confident, joyful patient, and it also breeds optimism.
The mind is powerful, and if we feel that we're being cared for and that those around us really care for us, I think that that goes very far in terms of treatment.
They're getting the best medical care, but as far as, patient service goes, I think empathy is the extra step that really kind of gives them comfort in their care.
I learned a quote a long time ago by Teddy Roosevelt: nobody really cares how much you know until you show them how much you care.
When you can look at a patient and say, I understand you're feeling anxious, I understand you're feeling scared, I think they immediately relax.
We normally come in contact with patients who are lost or upset, and we help change the mood by being polite and courteous towards them.
Each patient is considered a VIP to me. If we have to do whatever we have to do to go that extra mile to make them feel like a VIP.
We all went into this field for the same reason. We care about our patients and we're engaged in their health. And I think it's helpful for the patient to know that not only do we want to care for them, but that we care about them.
We're not just here just to do a job, but we're here to really touch their lives in a special way.
I think anytime you connect with people, you get, a positive endorphin or something, but I think that's what life is all about.
As a healthcare institution, we're a healing institution. If you really want to find yourself, lose yourself in the service of others, and that's what we do.
Sympathy makes a good caregiver better, unquestionably, but empathy makes that good caregiver extraordinary.
Coming in the room, giving them a song or making them laugh, and it just changes everything in the whole room. You are not alone. I am here with you. Though you may be far away, I am here to say you are not alone.